Coming today to talk a little bit about mangosteen in dentistry. Actually, I'm a dental practitioner in St. Paul, Minnesota. Practiced dentistry for over 25 years. I'm very highly specialized in the field of implantology. I do a lot of sedative dentistry, but I'm a periodontist by training, which I did some original research at the University of Minnesota. And I'll tell you, to be honest, when I was first introduced to mangosteen, I was a little bit skeptical. In fact, I don't think anybody could be more skeptical than I was. A friend of mine tried to show it to me, and of course he wanted me to show it to patients. And you know, being traditionally trained in allopathic medicine or allopathic dentistry, you know, I really couldn't get over the hump of, you know, promoting a natural juice to my patients, nor did I think there would be much value to doing that. But I personally had some reasons why I was looking for something myself. I had severe osteoarthritis. The physicians were offering me nothing more than painkillers or anti-inflammatories that I know have side effects. In fact, I was using Vioxx on an everyday basis until it got pulled off the market. And in either case, I tried the product. I was open-minded enough to at least try the product. And lo and behold, within a few days, I had no arthritic pain. I went off the product. My arthritic pain came back within a few days. I went back on the product and realized that in fact was what the missing element was. I've taken mangosteen juice ever since then on a daily basis. I have not used any pain medication since that point in time. Of course, at that point, even though I was not interested in necessarily promoting this to other people, nor my patients, you know, I'm just not that careless of a person. And I, of course, had to tell some friends of mine, one friend that had drug-induced hepatitis. Drugs given to him by his cardiologist to help prevent a heart disease was causing him to die of drug-induced hepatitis. And of course, he was on corticosteroids. I offered him a strong natural anti-inflammatory in the mangosteen juice, and within a few days he was having excellent results with it also. His liver enzyme test came back, and boy was he excited. Next thing I knew, I was helping him access the mangosteen juice wholesale. My second person or experiment basically was my mother-in-law. She lives in Poland, and we're in the United States. And of course we had to ship the mangosteen juice all the way to Poland, and we shipped it to her. I thought I was just going to help her with her arthritic knee. 2 weeks later, we got a call from her physician wanting to know what we gave her, because the first time in 10 years her diabetes was under control. Being a little bit of an inquisitive mind, I started questioning, you know, why was this happening from a juice? I mean, I had never had this kind of experience with a natural substance like this. And so I started delving into some of the research that's available. And as I researched mangosteen, the more I researched, the more I realized there was an incredible amount of science out there on this, the active ingredients in the mangosteen. I started to investigate this field a little bit more and became more and more excited about it. As I became more excited, I ended up having my first patient experience. That was a patient that had oral erosive lichen planus, which is an autoimmune disease. And she had been down to other clinics throughout the Minnesota area, had drifted in and out of offices for 12 years. Nobody had ever helped her with her condition. She was Asian descent, and of course she knew the mangostanfruit, she called it, from her culture. And she said her grandfather used to use it for medicine. She got quite excited when I told her that it was now available in a whole fruit puree from a company here in the United States. In either case, we had her lavage her mouth gently with it 3 times a day, along with the oral dosage, taking it systemically 3 times a day. And within 4 or 5 weeks, her oral condition was entirely healed up. At that point, I started to realize that I had something very unique. And of course, I've been validated. You know, I knew it was a strong anti-inflammatory. I knew we could use it for modulation of periodontal disease. Just recently, we've had some studies come out of Thailand in clinical human studies showing that, in fact, it does modulate gum disease, does reduce bleeding index on patients that are using mangosteen juice as a lavage, as opposed to patients that are just receiving traditional therapy. Of course, I was seeing this clinically and have seen this clinically for the last 3 years, and we've been using it in our practice accordingly. Quite often I use it wherever I would expect a lot of swelling. I do a lot of reconstructive surgery where I would expect to have a tremendous amount of swelling. Those would be cases where I would maybe put them on a Medrol dose pack or corticosteroid dosing for a few days prior and after the surgery. I no longer believe in doing that. There's no sense taking a risk. A good friend of mine says, why would you use a drug when a food could do the job? And so I commonly prescribe the mangosteen juice for them instead, and I have better results with mangosteen than I do with the cortical dose pack. Other areas is modulating, like I say, periodontal disease. It's not a substitute for treating periodontal disease, but in conjunction with traditional therapy, my patients that are on the mangosteen will heal better and will have better results therapeutically in combination with traditional therapy. I've also used it post-extractions. I do quite a bit of wisdom teeth removal, and some of them can become very, very serious impacted teeth and very serious post-operative swelling and pain. There again, I found that patients that are on the mangosteen a day or two prior to the procedure continue the dosing, oral lavages in their mouth, holding the mangosteen in their mouth before they swallow, after the surgery, heal much quicker. The healing results at 1 or 2 weeks looks like they've healed 2 or 3 weeks healing time. So they heal much more rapidly, and we have an excellent result. But at the present, I would say we have over 100 patients that have used the product on a regular basis. I think anytime we have something of this significance, this kind of research behind it, just because it's a natural form, it's not a drug, doesn't mean that it doesn't have validity. And I think we should be looking a little more naturally. And I think a dentist or a physician that's not realizing that the patients are starting to look back towards natural remedies as opposed to the drugs. And I think a lot of the American public is just plain fed up with what's going on out there. And a lot of doctors and dentists are starting to become aware of that. And the ones that are capitalizing on that now have nothing but increase in their practice growth as they start to become more aware and promote more natural sources of healing for their patients.